right thing at all times.
Nigeria, good people, great nation.
You're still on to Kapital FM 92.9, the station that works on Kapital Cruise. But we have a special guest. We're going to talk about malaria, the effects, how to prevent it, because tomorrow is World Malaria Day. It's a day that is observed annually on April 25th, serving as a global platform to raise awareness about malaria and to mobilize efforts for its prevention and control. World Malaria Day, WMD, is an international observance commemorates every year, 25th of April, and recognizes global efforts to control malaria. Globally, 3.3 billion people in 106 countries are at risk of malaria. In 2012, malaria caused an estimated 627,000 deaths, mostly among African children. Asia, Latin America, and to the lesser extent to the Middle East and parts of Europe are also affected. To discuss this awareness or to tell us more about Malaria Day, we have a guest in the house. She is a pharmacist, Ngozi Obuti, fellow of West African Postgraduate College of Pharmacists, also publicity secretary of Association of Hospital and Administrative Pharmacists of Nigeria, AHAP. You're welcome, Mrs. Ngozi.
Thank you.
Can you please tell us what is the most important significance of Malaria Day and why?
It's significant because malaria has ravaged us in this country, dealt a blow to every one of us in this country. Malaria is the leading cause of most illness and deaths, so that's why it's significant.
What exactly is malaria and why does it remain such a major health burden in Nigeria despite years of interventions?
Malaria is a life-threatening disease caused by a plasmodium parasite, and is transmitted through the bite of infected Anopheles mosquito. Despite decades of intervention, malaria remains a major burden in Nigeria due to a combination of factors, and these factors can be as a result of poor sanitation, limited access to timely diagnosis and treatment, especially in rural areas, and the widespread mosquito breeding sites like we have in Nigeria today. Everywhere you see is mosquito breeding sites. You look around your area, you see gutters dumped with refuse. What does it tell you? Definitely, mosquitoes are going to breed in such areas. So, it's really a serious burden. That's why we're here today, to see how we can raise awareness on this, celebrate progress on what have been achieved so far, and invest in preventive measures and access to treatment.
But when I was growing up as a younger back then, well, we were told to be using chloroquine for the treatment of malaria. Is it still in use now?
No. Chloroquine is not in use because it has developed a lot of resistance. There's a lot of resistance. That's why chloroquine was stopped as treatment of choice when it comes to management of malaria, or treatment of malaria rather. So the gold standard now is no longer chloroquine, though it used to be. But the gold standard now is artemisinin combination therapy. That is the most effective treatment now for management of, or treatment of malaria rather.
Okay, from your own perspective as a pharmacist, how big is malaria in Nigeria right now?
Very, 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 very big.
Oh, the very is even three.
So you can hear it from my voice.
It's very, very three. Because the very, very big. Before you answer that question, please, we have a guest, Dr. Abubakar Raka, Zona Coordinator, Abuja Zone of West Africa, Postgraduate of Pharmacists. You're welcome to the studio.
Thank you very much.
Okay, let her answer the question.
Okay, so because malaria remains one of the leading causes of illness and deaths, especially in Nigeria, because it's very, very endemic here. So as a pharmacist, we see clearly the burden it places on families, especially young children and pregnant women. So it affects productivity. If you're sick or your child is sick, you not go to work. Therefore, what happens? Productivity is affected. That same child is not going to school. His or her education is affected too. And what does that mean? Household income is affected. So you'll agree with me that malaria is not just a health issue, it is also a socio-economic problem, which is why we really need to tackle it before it's too late for all of us.
Dr. Abubakar, let me come to you. Madam Ngozi has already said so many things before you came into the studio. I want to ask, between an adult and a child, what are the tendencies of malaria being affected in them?
The vulnerable groups, I must say, to malaria are usually the children under 5 and the pregnant women. So an adult knows how to protect himself from the bites of the female Anopheles mosquito, because malaria is as a result of the bite of the female Anopheles mosquito. So as much as possible, the vulnerable population that are disposed to malaria, and even all the activities that are geared towards is to protect the vulnerable. Pregnant women, because of how devastating malaria is in them, easily causes abortion, then immediate death in children under 5.
When you said abortion, are you saying that someone can have miscarriage with malaria?
Essentially, it leads to anemia as a result of lack of blood. Before you know it, a lot of pregnancies are lost as a result of malaria. It's that bad. So the vulnerable group, in answering your question directly, malaria affects more of children because they cannot ward off mosquitoes, and at the same time pregnant women because of how deadly it is in them. So adults too are exposed, but an adult withers with the burden.
Yeah. Okay, tell us about intervention of malaria in Nigeria.
Indeed, the Nigerian government, through the Federal Ministry of Health, have what we call the National Malaria Eradication Program, Elimination Program, which has done a lot of things. One of the important intervention is in line with the Global Fund Rollback Malaria Program. They have been advocates for awareness as much as possible, releasing funds for insecticide-treated nets, because the control of malaria is targeted mostly at vector control. If you are able to tame the vector that carries the malaria parasite, essentially you will do more than half of reducing the burden of malaria. So the sharing through the primary healthcare interventions and also the National Malaria Eradication Elimination Program, they have shared, I'm sure listeners are aware of the door-to-door sharing of insecticide-treated nets through a lot of immunization programs. And most recently, the federal government has approved through NAFDAC the uptake of the malaria vaccine that has just been brought in the last 2 years now. It's in pilot stages, but it's now put together as part of the free schedules for immunization for under 5 children. So federal government is doing its own bit, and associations like ours, the West African Postgraduate College of Pharmacists, as well as the Association of Hospital and Administrative Pharmacists, we go ahead to do advocacies to enlighten the public. Like tomorrow we will be in the field at Gwagwalada to interact with the people, to inform them that knowledge on how to prevent self is key.
That was the question I'm about to ask you about the outreach and the awareness for tomorrow.
Yes, you see, the team is very clear.
And how far have you gone about it? And do you think it will get to the grassroots?
The whole essence of the outreach is to meet people at the grassroots. Some years back, just barely 2-3 years, we were at Kadu, the Chief's Palace, and tomorrow for this year's own we will be at Gwagwalada, just at opposite the field, opposite Kontagora Estate. We have invited youth and women groups and the market women to give us some time from 9 a.m. till 11 to interact with us and get informed on how to prevent, because prevention is the most important thing. Because of high cost of medicines now, to treat malaria is no longer like before. ordinarily before less than 500 naira can manage your malaria, but now to effectively treat malaria, you need more than 2,000, 3,000 thereabouts. So the message we are selling is empower yourself to prevent the malaria by, once you take care of access the environment, that's where you have stagnant water, clearing the gutters, clearing bushes, you remove the breeding ground for malaria and vector control, use of nets, insecticide treated net, and netting, that's you screen your environment and avoid coming out with short sleeves or exposing your limbs to bite, because the mosquitoes are more active at dawn and dusk and through the night. So if you are able to protect that, you are good to go.
Madam Ngozi, can you tell us, do you have any collaborators with it during this program for tomorrow? Are there any collaborators?
We are collaborating with the Pharmaceutical Society of Nigeria. Those are our collaborators for now. And we're still asking for sponsorship. More. Yes.
Yes, I must
because
add,
you cannot do it alone.
Yes, I must add we have collaboration with the community, because if the community do not accept us, definitely the message will not drive up. The other collaborators my colleague is talking about is the funding collaborators, because it's a three-part arrangement. Even if you have good intervention to make and there is no proper funding for logistics to execute it, you will not get anywhere. But if you have the funding and you have the interventions and the community are not ready for the uptake, you will also lose out. So we do have collaborators with the communities that we choose and go around every year.
Okay, that's all we have for you today. I will say a very big thank you to our guest, Dr. Abubakar Dalrak, Zona Coordinator, Abuja Zone of West African Postgraduate Pharmacist, and Pharmacist Ngozi Obute, Fellow of West African Postgraduate College of Pharmacists, at the same time Publicity Secretary of AHAP. Okay, can you please tell us details of your awareness before we round up the whole program for today?
Okay, what we're here is to tell the public that malaria is preventable and is treatable. Because if we can do all we are supposed to do, you'll agree with me that we'll end malaria in Nigeria like now. But unfortunately, the things we are supposed to do, which are very simple things that we're supposed to do, very simple steps that we're supposed to take, very simple measures that we're supposed to take, we are not taking them. So if all our hands can be on deck to be able to strengthen the preventive measures. And what are these preventive measures? Use of mosquito-treated nets, clear our stagnant waters, clear our grasses, our surroundings, we keep it neat, and we use insecticide.
Okay, Doctor, please give us full details of your location and time for the tomorrow awareness.
The awareness tomorrow is a function of the Pharmaceutical Society of Nigeria. We have the voluntary healthcare support team that is going to be available on site at Gwagwalada, directly opposite the Kontagora estate in Gwagwalada. That's where we'll be from 9 till 12 by God's grace, and we'll be there to take care of health needs. That's health screening. Basic health screening is not only about telling people what malaria is about and how to prevent it. We are also doing free health checks, because health screening and health checks is an integral aspect of maintaining health, and that is where we are.
Thank you so much.
Please, before you go, I want to ask you a question.
Okay.
Do you use mosquito net in your home?
Not really, because I do have mosquito net. Yes, one, and also use bigger insecticide.
Please,
yes,
use one. It will help.
Thank you so much.
Thank you very much.
Coming.
Thanks for having us.
This is Kapital FM
92.9.